Yeah, there's a lot of bad things going on in the world, and we could take the entirety of this program for today talking about the upcoming subject. Dr. Jared Ross joins us, the senior fellow at Do No Harm, exposing the sex change industry at the Children's Hospital of Philadelphia. Dr. Jared Ross, thank you for joining us today on the Schilling Show.
Rob, thanks so much for having me. Pleasure to be on the show.
Do No Harm, a terrific organization, has put together a Stop the Harm database. Would you tell us briefly what that is?
Yes, Rob, thanks so much. We all see this harm that's being done to children justified by this radical gender ideology. And in the past, it had not been quantified. So that's why we undertook this process. We're a fact-based, science-driven organization. We wanted to understand precisely how widespread this problem is, to pull back the curtain on the medical industry and provide concerned parents with the facts. And what we found is very concerning.
Yeah, so a lot of people over time have been scratching their heads saying, why would anybody allow this to be done to children? I mean, it's hideous. It's beyond grotesque. And yet now we know. Follow the money, right?
Yes, absolutely. Follow the money. Follow the activist doctors. Follow the ideologue doctors. These are doctors that are doing grievous harm in the name of medicine. They are not there taking care and doing what's in the best interest of their patients, these vulnerable, innocent children.
So there was a conspiracy of sorts between Rachel Levine, Tom Wolf, the former governor, and CHOP, which is an interesting name for what's going on at the Children's Hospital of Philadelphia, to bring a sex change industry like a haven in Pennsylvania. Tell us about that.
Yes, so we created our Stop the Harm database, and as part of that database, we picked the worst 12 offending children's hospitals, our Dirty Dozen, and at the top of that Dirty Dozen is the Children's Hospital of Philadelphia. Ironically, they go by the moniker of CHOP. And we picked them for their dedicated gender clinic, their procedures, the activism that they perform, and yes, they are very much colluding with Health and Human Services Assistant Secretary Admiral Levine.
So what has been the actual numbers, and what ages are we talking about here? Like how many and who is in this demographic?
So our database is a 5-year period from 2019 to 2023, and we plan to continue to update it as new data becomes available. Nearly 14,000 children receiving sex change treatments, and that includes nearly 6,000 child sex change surgeries and nearly $120 million. These are all children under the age of 17 and a half.
And when we talk about under 17 and a half, how low does it go when they start doing these horrible procedures or giving them drugs? What age do they begin?
We see this, unfortunately, down as low as 7.5 years old.
So I've got to ask you about that, and I'm just wondering what you're hearing in response from these various quote-unquote hospitals when they're doing these things to 7.5-year-olds who can't even consent to get an ear pierced, and yet they're having genitals cut off or being given life-altering, biological-altering chemicals.
Yes, unfortunately, WPATH, the World Professional Association for Transgender Health, which is a highly ideologically captured organization of activist doctors, revised their standard of care guidelines last year and actually sent that to Admiral Levine for review. And Admiral Levine's suggestion was to remove all of the age requirements that were in there for the different types of procedures. Now, mind you, there was no age minimum in there for puberty blockers, but there were age minimums in there for cross-sex hormones and different types of mutilating surgeries. And Admiral Levine was successful in getting WPATH to remove those and manipulate the standards of care of a professional, ideologically captured, but professional organization, the government meddling in medicine here.
Well, we've got just a couple minutes left. We're talking with Dr. Jared Ross, a senior fellow at Do No Harm, talking about the sex change industry at the Children's Hospital of Philadelphia and the Stop the Harm database, which we'll give a website for in just a moment. So I'm very curious, Dr. Ross, because of all the work that you've done with the Stop the Harm database and the publicity it's received, if there has been pushback against CHOP and other institutions.
Yes, we've launched a media campaign to bring this to light in the state of Pennsylvania and across the nation. We've had some other organizations who have been broadcasting our database and pulling data from it to inform the public. And I think that light is a great disinfectant. We're really showing what's going on in these hospitals, not just the children's hospitals, but other hospitals, private surgical centers, and I think we're going to start to see some very significant change here. And we've seen change in some states in the nation, but we'd like to see the U.S. completely reverse course on this and follow Europe out of this very dark hole.
If people would like to visit the Stop the Harm database or get more information on your work at Do No Harm, how can they do that, Dr. Ross?
Rob, thanks for that. Our website is donoharmmedicine.org, donoharmmedicine.org, and there's a link at the top to the Stop the Harm database. You can also go to the database directly, stoptheharmdatabase.com. Again, that's stoptheharmdatabase.com.
Dr. Jared Ross, we're grateful for the work you're doing at Do No Harm. Thank you so much for joining us today on The Schilling Show.